Hello, my name is Jane Hinson, and I'm the Iredell County Health Director. Just to give you a brief update on where we are with the COVID pandemic in Iredell County. Today, we have 22,306 positive cases. 43% of our citizens have received one dose of vaccine, and 41% are fully vaccinated. According to the CDC, since July the 29th, we have been identified as a county with a high level of transmission. Just this week, we had 98 of our residents hospitalized, making it extremely difficult for our hospitals to provide care for all individuals in need. And about 90% of the hospitalizations throughout the state and the country are in individuals who are not vaccinated. To tell you a little bit about the Delta variant, about 90% of individuals, 90 plus, who are testing positive right now, it is from the Delta variant. And we know this because private labs and the CDC actually do sequencing of the test specimen. So this is certainly the variant that we are seeing right now. With the Delta variant, it spreads twice as easily as the original virus. It is actually more infectious person to person than Ebola, smallpox, cold, or even the flu. And symptoms very similar to the original virus that we saw from Wuhan, but less likely to lose your sense of taste or smell. And from case investigations that we have done previously, oftentimes it was when individuals did lose their sense of taste or smell that they thought they needed to get tested. So I say that because that might not happen. So I would encourage individuals with other symptoms, cold symptoms, fatigue, cough, shortness of breath, to go ahead and get tested. In the United Kingdom, recently, there was research that showed that children and adults under the age of 50 are 2 times as likely to become infected with the Delta variant. Even in the schools last year, majority of the cases were in adults. But just with the few weeks some schools have started in this current week for Iredell Statesville, there are a lot of school children that are getting infected. Our current vaccines still provide excellent protection against severe illness, hospitalizations, or death. Does not provide the same level of protection when it was originally created for the original virus for mild infections or even individuals who may be asymptomatic and may be infected to others. So, of course, there has been some breakthrough cases. But again, remember, it is still important to get vaccinated because if it lessens your likelihood of having severe illness, hospitalizations, or death, then it is important for you to do that. We don't really know. We know that you will have some protection from natural immunity. There still needs to be a lot more research done. Every individual's immune system is different. So what we know is that might not be consistent from one person to another. If you are vaccinated, it teaches your body how to respond if exposed to this variant or any other mutation of the COVID-19 virus. We are currently offering an additional dose to individuals who are severely immunocompromised. And this would be someone who possibly has had a transplant, maybe going through cancer treatment, severe HIV disease, they may be taking high-dose corticosteroids, or have an immunodeficiency disease. Boosters, you've just heard that recently, will be given when all the final approval has been received. If you received an mRNA vaccine, which would be Moderna or Pfizer, and if it has been 8 months since you have been fully vaccinated. More to come on that. You can check our website. We will be advertising when we do receive the final go-ahead for that. And I want to touch on the communicable disease laws in North Carolina. There are over 80 reportable diseases in North Carolina, and each disease has its own set of control measures. This could include quarantines and isolations. For COVID-19, masking indoors is an important control measure, social distancing and good hand washing. North Carolina develops those control measures after reviewing the scientific research and CDC guidance. I've received a lot of phone calls and a lot of emails, and I understand the concern if you're a parent, if you have a student who's had to be quarantined. And I also understand how difficult the decision is right now in regards to whether or not students and staff need to be fully masked at all times when indoors. I want to be clear so that you understand that these are not rules of the Iredell County Health Department. We have state communicable disease laws, and in those laws, we are bound statutorily to enforce those control measures. I know that this is causing a lot of frustration and a lot of angst, but we all are after the same thing. We all want children to be in school, but we also want it to be a safe environment for all, not only your child, but children and adults and staff who have compromised immune systems. We do not want to see individuals exposed and infected at school who end up hospitalized. So please, I ask you, it is your decision whether or not you want to get vaccinated. I only ask that you get accurate information. Please don't listen to a friend, a neighbor, Facebook, or any other social media. Please get factual information from our website, from DHHS, from the CDC, and then make your decision. And you do that when you look at the risk and the benefits. I can tell you, I have an 89-year-old mother that lives with me, and it was not a choice for me. I personally took the vaccine to protect her. I ask you as a community, can we work together so that we can slow the spread of COVID-19? Thank you.